Welcome to the Modern Nurse Podcast. My name is Emily Knife, and I am your host today with somebody very special who will be actually at Modern Nurse Fest. We have Sunny here today joining us. I'm so excited. Thank you, Sunny, for joining us today. She is the teaching NP, and she's going to share a lot with us about celebrating NPs outside of their traditional role. And we'll talk a little bit about what she offers as well with inside her business. So, Sunny, thank you so much for joining us today. I'm so excited to have you on our show.
Thank you so much, Emily. It's a pleasure to be here.
Sure, of course. So, tell us how you got where you are today. I know you're a nurse practitioner, and kind of tell us and share with us your journey of how you became a nurse.
Yeah, so became a nurse many, many moons ago. But in terms of how I got where I am today, it basically started where I was doing bedside nursing in orthopedics and trauma. And then I felt like I needed more autonomy and responsibility. And that's where the option of pursuing my nurse practitioner stream and the master's degree came into place. And so I applied to the program, I was accepted, and I completed my master's in 2012. And during that time, there was a specific exam that nurse practitioners within BC, Canada have to prepare for called the OSCE exam. And at that time, I recall there just weren't many resources to help us prepare. And so I started to create these resources and systems and templates to guide myself, which I then started to pursue in teaching others. And that's sort of where this journey sort of started from. And so I started to teach others how to prepare for this exam. And I've been teaching now for over 12 plus years. And from there, I've created many, many different nurse practitioner resources from a nurse practitioner student master course, as well as a physical exam course, an OSCE preparation course, and template bundles, and lots of different products and resources. And I think the key was that when I finished my NP program, I found that there was just a lot of gaps in my knowledge, and I didn't really have the practical clinical skills to be able to go into a patient room and complete a thorough history, perform a physical exam, create a management plan. There was just a few too many gaps, and that's where these sort of learning tools that I created came into place. And I've been teaching ever since now.
Yeah, that's awesome. Yeah, that's so great. And it's talk about innovation, right? Innovation's so big in nursing right now. And right there, you found a gap and you fulfilled the need and you found a solution by creating the teaching NP, which is so cool. So, as an educator, is that your full-time job? Do you just do this as a full-time? I know that you have another special job as well. So tell us about what you do during the daytime as a
Yeah,
nurse.
so I have three daughters as well, which they're very active girls in lots of different activities. So that keeps me busy. But I actually also work as a nurse practitioner in neurosurgery. And so I do that 3 days of the week. And I'm at one of the largest hospitals in the province here. And so I work in an acute care setting, many patients pre-op, post-operative, help with complex discharges, or you're dealing with sort of various complications post-operative from aneurysm surgery or brain tumor resections, various vascular interventions that are done. And so that's where I am the other few days of the week.
Yeah, yeah, that's amazing. Yeah. So, if you are a nurse, like Sunny, she still works at bedside, she's still working
Yeah,
in the hospital. So, don't think that you have this wonderful idea and all of a sudden you're just going to quit your day job, right? Like that's not how entrepreneurship works. You have to fund your
absolutely.
dreams. So, this is a very common setup for nurses. We work somewhere during the day and then we are something else on the other days that we're not, at our traditional nursing role. So know that if you do have an idea, if you have a vision, know that you can do it. It is totally possible. As Sunny also has three daughters. So a lot of our nurses that are listening might be moms as well, or even caregivers. So don't let your dreams die. Please pursue your dreams like Sunny did and filled a need that was needed for our NPs. So celebrating, so let's just celebrate for a moment, right? Because a lot of times we don't celebrate in nursing. Many times there's, these toxic environments and there's lots of, kind of disregard between nurses. So let's just take a deep breath in a moment. So if you are a nurse or a nurse practitioner or any type of nurse role, just take a moment to celebrate yourself, and give yourself a pat on the back because that's so important that we validate ourselves, right? A lot of times we don't get that external validation. Like nobody's standing over you being like, "Great job, Sunny. You
Yeah.
just put an IV in," right? Like where it just doesn't happen. And so, as nurse entrepreneurs, a lot of times we do have to rely on that internal validation. So, that being said, the journey from being a hospital NP to being at bedside, what kind of pivoted you into wanting to start this journey of the teaching NP? What really pushed you into it? I know you said that there were gaps and things, but what really was like, okay, I'm ready to do this. This is what I want to do.
Yeah, that's a great question, Emily. I think it just came from my own struggles of trying to prepare for that particular exam. And I literally remember one night I had the idea of, hey, wait a second, if I'm struggling and a lot of these methodologies and systems that I've created to help me do well on this specific exam has really helped grow my knowledge, then I'm certain that I can help others. And I think I just made the decision, I'm going to take a chance. I'm going to put myself out there. I'm going to be vulnerable and see where it takes me. And I basically asked 5 students if they wanted to join me for a day where I taught them to help them prepare. So the things that we covered were things like patient history taking and developing management plans and performing physical exams. And, at the end of the day, they were like, we want more, we want to come back. And, and that was for me, it just ignited a fire in me because I saw the look in these students' eyes of how they just felt like they learned so much. And they felt like there was hope for them because a lot of them felt a little bit defeated or lacked a lot of confidence that were they going to pass the exam, and also many questioned whether they deserve to become a nurse practitioner or whether they could actually do it. And I think for me, having gone through so much adversity in life through childhood, um, I had to show myself that regardless of the path you've gone through, you are able to change your own path depending on the decisions you make and what you actually want for yourself. And I think through my teaching, I've met so many people who've come from such diverse backgrounds and many who just don't believe that they should be where they're at, but they have every right to be there. So I think a big piece of what I do is to provide that self-belief and mentorship because it was such a big part of my journey and I saw what it was able to do for me. Um, and so that's my main impact that I really want to make. And I think celebrating, as you mentioned, that, RNs and LPNs and CAREs and nurse practitioners, we bring such different skill set. And it's okay that we don't follow a traditional path. It's okay if we have 2 or 3 different part-time jobs and one of them is a passion, and if there is something out there that you want to create that doesn't exist, I would say go for it, and a huge part of it is having grit and consistency. And if you don't have those things, it's going to definitely be challenging. But if you can continue to push through the various obstacles, stay consistent, and particularly that piece of having grit, that's really, really important. And it's going to get you there. But you have to have patience for sure. But it's well worth the ride.
Yeah, for sure. Yeah. And, I think I can piggyback on saying that the grit is so important, and to believe in something you can't see is probably the hardest part. Just having the faith and knowing that it's going to work out. Even if it doesn't work out, it still works out for some reason, right? Like even if something fails or you have a terrible mistake, like it's still working out in your favor in some weird way that we are totally unaware of, right? So, yeah, the grit is so important, and just believing that you can do it. I think, that you offer that mentoring and guiding and the confidence building. Because nurses, sometimes we put our worth on that hourly rate we get. And, we're way more than that hourly rate. We don't even, nurses aren't even compensated by insurance for the stuff they do, right? We don't even have like a ICD-9 code or ICD-10
Right.
code. It's all for services, procedures, and therapies. But nurses don't even have their own code. So, your worth isn't contingent on your hourly pay, or even the education that you've come across, right? Because the education, Sunny, that you've received, did it have any like nursing education in it? Was your master's nursing education focused, or was there a different focus to your NP?
Yeah, the main focus was the nurse practitioner stream. There wasn't elements of education per se. There was some philosophy, some leadership courses within that, but I think for me particularly, I'm more of a self-made educator.
Mhm.
And
Yeah.
that means the way this came about was seeing myself in this chair in front of me as a student, and what did I need? What kind of learning, what kind of teaching did I need to get me to the place that I needed to get? And how did I need my educators to teach me as a student? And so from that lens and from that perspective, I became the educator and started delivering what I think commonly students do need. And I'm always continuing to reflect and seek insight into the delivery of my education, because I do recognize everyone learns differently. Hence, that's why I create many visuals or videos and templates just to ensure that we're meeting all of the needs of our learners. I think that's a really key part.
Yeah, yeah, that's so lovely. And you just go to show that, you know, um, you really can become anything in nursing, right? You don't just because you have this license and you got your NP doesn't mean you can't dabble in other areas. And that's what's so great about
Absolutely.
nursing is, that's why it should be celebrated because there's so many options. And just because you don't have that education formally, you don't have a piece of paper from a university that you paid 100 grand for saying that here we've deemed you a nurse
Yes.
educator, so a lot of the times as nurses we've already been through that rigorous training, so why not learn other stuff? Why not learn how to do other stuff that might be outside of the traditional roles of nursing? So yeah, that's
Absolutely.
awesome. I love your program. I love all of the digital assets too. So speaking of, being an entrepreneur and having digital assets, did what was the process for that? Was that a hard process for you to create those courses? And, did you have help along the way?
Yeah, so Emily, I initially, I offer in-person courses as well as the digital services. And the digital courses came about specifically for COVID, when COVID came about, but it's definitely something that I had thought of doing for some time, just to provide my services to more NPs around Canada, the United States, or whichever country, they reside in. And and so that meant creating these digital products. And it was definitely a long journey, and that again being because I always had the learner's view in mind. What do they need to see, within this online course in order for them to learn? How do
How do
I
I?
create this course so that it's delivered well? And so one of the courses, for example, the Nurse Practitioner Student Master Course, that one was specifically created to teach nurse practitioner students, new grads, and those needing a refresher how to optimize those foundational clinical skills, such as how do you gather a patient history? How do you develop a medical management plan? How do you provide patient education? How do you perform physical exams? And so that was created over a 1 year period. And I worked with an e-course developer and a website developer, and then also a videographer in order to help shoot my physical exam videos. And so a lot of the courses overall took, at least a year to create because of all the coding involved. And so it was quite a journey, and lots of revamping and edits, were made along the way. But, I learned so much in the process. I learned that okay, I don't know how to code. I don't know how to manage a website, but I learned little bits and pieces along the way, and recognizing I'm still a nurse practitioner. I haven't gone to any sort of formal training or, gotten formal education, but you can learn so many skills without formal training.
Yeah.
And I think that's a key piece. And so if, for example, being creative or being artistic is one of your passions, which is one of mine, for example, and creating things is one of mine, I was able to bring that into the business, and create these different products and services. And again, with the focus always being that it has an impact for nurse practitioners and the nurse practitioner profession.
Yeah.
Yeah.
Wow. Yeah, that's so cool. And, to speak of, just thinking outside the box, right? Getting education elsewhere. And that's
Yeah.
the great thing about nurses. We're delegators. Like we can delegate, right? If we need somebody to design a website, if we need somebody to edit a book or what have you, those are, people that are out there that can help us. So absolutely relying on other resources can be a huge part of being an entrepreneur, right? Like don't do it all yourself, which I'm kind of doing right
Absolutely.
now. Like just don't,
Absolutely.
you've got to
Yeah.
have help. So
Yeah.
yeah, that's so important. And so um what is something that you can help with? A lot of nurses get that imposter syndrome. And even though we've had all this wonderful education, starting something new can kind of feel very daunting. So, what are some tips or some loving knowledge you can give our listeners to help them kind of get that final push or nudge to get over that hump to get started?
Yeah, I think, imposter syndrome is quite a concept. There's lots of information and resources out there about it. And I think I'm someone who doesn't necessarily believe in fake it until you make it. I
Yeah.
think you should look at where are the gaps in my knowledge? What is truly keeping me awake at night? Is it performing a physical exam, specifically a neuro exam, which then means you may not know your cranial nerves. So how do I learn my cranial nerves? And so I think a big piece of supporting that imposter syndrome feeling is, put pen to paper and identify where am I struggling, write it down, and then next to it, I would encourage students to write down what their self-limiting beliefs are. So if it is around a neuro exam, your self-limiting belief might be, there's no way I can remember all of these. But then the way that you target that self-limiting belief or question it is, well, have you practiced? Have you truly, actually worked through a neuro exam, working from cranial nerve 1 to 12? And so I think it's starting there and knowing that through consistent work and practice of these various skills, you can get there. And the truth is, within any field of healthcare or medicine, we're never going to know anything, and with myself working in neurosurgery, every day I'm learning something new, or every day I leave work thinking, I wonder why this patient had this neurological deficit, even though the tumor was resected from this area, or, and sometimes it's one of those things that keeps you sort of thriving in the workplace, right? Is that you are always learning. And so I think it really is identifying where are you actually struggling? How can you overcome those challenges? And are you actually putting in that work to help support that growth to get you there? And then I think the little pieces, to support that is seek out your resources in the workplace. Who are your go-to supports? Find a mentor within your workplace if you can. Ask yourself, did you get appropriate orientation? Or, when you're at a job interview, ask those questions. What does the orientation look like? What does the mentorship look like? I think these are very key pieces. Is there a residency involved? Is there additional training they would recommend? Because you want to set yourself up for success. And I think having that sort of explorative conversations during your interview period are so critical to get you there.
Yeah, absolutely. Yeah, you make so many good points in that. And, in imposter syndrome, I feel like it's just this kind of, I mean, somebody made it up, obviously, but it's like, I think it's just a small lack of confidence because you're new at something, right?
Yeah,
It's
yeah,
like and it's like, it's not really imposter then because you're new at something. So, of
exactly.
course, you're going to be lacking confidence, right? It's like,
Absolutely.
when we go and do a catheter, I mean, my hand
Yeah,
was shaking so bad, I'm surprised I even hit the hole, right? So it's
yes,
like, you
yeah,
know, um, and my limiting belief was like, I'm never going to be able to do a catheter, right? And it's like we go to these extreme limiting beliefs when we
exactly.
lack the knowledge and the experience and the confidence.
Yes,
So I think you make some really good points about identifying, like seriously, take some time with yourself, right? And like
absolutely.
identify where you struggle because yeah, faking it till you make it, you're only going to keep struggling harder and harder
Exactly.
until you face yourself and be
Yeah.
like, yeah, I struggle here and these are my resources, right? So so if you're an NP and you are struggling with studying for your exam, here's your solution right here.
Yeah.
Go to Sunny's website,
Yeah.
go to her social media. She has lots of great videos on her social as well of just teaching how to do different parts and pieces of the nurse practitioner exam. Very good, by the way. I do have an education background, and I highly suggest Sunny's course and everything because she puts it out there in so many different ways that you can learn. And that's really big. So thank you, Sunny, again for coming to the Modern Nurse podcast. She'll be at Modern Nurse Fest October 19th, Saturday at 1 p.m. Eastern Standard Time. And so I highly suggest coming for that if you're a nurse practitioner student or even nurse practitioner or even just a nurse and you're gonna eventually become a nurse practitioner. She has some awesome things that she's going to be sharing with us. So again, Sunny, anything else that you would like for our listeners to hear today?
Yeah, I think the last point would be, Emily, is, us hitting on imposter syndrome. I think what sort of has come within society is we are labeling everything. And so if you're not confident on, for example, inserting a Foley catheter or performing that neuro exam, we don't always have to say, oh, I have imposter syndrome. This is why I cannot. And now I need to read 3 books on
Yeah.
imposter syndrome, where the actual method that you should be implementing is, well, how am I going to learn to insert that Foley, or what steps do I need to take to practice that exam? So I think sometimes just recognizing that you lack some confidence because you don't have the experience and skill set yet is why you're feeling the way you do. And so I think if we simplify things a bit and take a step back and recognize you're just a novice learner and things will come, I think that's a really good perspective for learners to take. And so I just wanted to leave listeners with that.
Yeah, yeah, that's lovely. And that's so true, right? It's like just stop labeling everything and make it focus more of the experience rather instead of labeling it because when you label, you limit.
Absolutely.
And so yeah, I think that's a great tip as well for our listeners. So again, thank you, Sunny, so much for sharing that with us and sharing all of your wonderful things. And you can find Sunny on social as well as LinkedIn. She is the teaching NP on social media. So you can find her there as well and follow her. And again, see her at Modern Nurse Fest in October the 18th through the 20th. So again, thanks, Sunny, for coming today. We appreciate you and keep doing what you're doing. You're amazing.
Thank you so much, Emily.
All right, take care.